Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. I'd like to welcome back Lanette Siragusa, Chief Nursing Officer and Provincial Lead of Health System Integration and Quality for Shared Health. As you'll hear from Lanette this afternoon, we've had a growing number of cases and are having an impact on our healthcare system capacity. Lanette will join our regular briefings and will be able to speak and answer your questions about the health system going forward. And so it's certainly disappointing to be in a position where we need Lanette back to discuss the healthcare system capacity. Manitobans that I know that we can rely on Lanette to give us vital updates and speak on the state of our healthcare system moving forward. So welcome back, Lanette. Today we are announcing an additional death related to COVID-19. This is a female in her 80s related to the Parkview Place outbreak. So I want to extend my condolences to the family and loved ones of all the families of the 7 individuals whose deaths were announced since last Thursday. Our current 5-day test positivity rate is 7.1%. with 100 new cases of virus being identified as of 9:30 this a.m., bringing our total number of lab-confirmed cases in Manitoba to 4,349. Based on increasing case levels in northern Manitoba, new COVID-19 public health orders have taken effect as of 12 a.m. this morning. These restrictions include reduced gathering sizes, the closure of casinos, bingo halls, and entertainment facilities, reduced occupancies for most facilities, and increased contact tracing by organizations and businesses. We continue to work closely with our northern partners to reduce transmission in that region. As we mentioned, as we've expanded the restricted level to the north, we're also making changes and requirements for schools. Manitoba schools have up to now proven safe and low risk for transmission. We've certainly seen a number of cases within schools, but those are acquired in the community, not acquired within school. And so due to the hard work of education and all our partners there, we've seen very little transmission within the school. But because we are seeing more widespread community-based transmission, we put increased measures into place because we can expect to see more introduction of cases within those schools. You know, our big message to Manitobans is that we need to reduce the number of contacts we have outside of our household. And so all of these restrictions are really there to change the way people are socializing. We need to keep the numbers of cases low, and that keeps our ability for people to go to work, go to school. It protects our most vulnerable citizens. It also reduces the impact on our healthcare system. And so we look at from last Sunday the 18th to Saturday the 24th, we announced 14 deaths. 14 Manitobans. We also announced 831 cases. 831 cases in a single week. On this trajectory, we expect to have more than 5,000 cases by the end of this week. Many of these cases are linked to social gatherings. We're seeing people who are socializing with many different contacts in many different large groups. We've seen many of these cases linked to Thanksgiving. Case investigations are showing multiple people from one gathering. We've seen funerals with many people attending, leading to a large number of close contacts and cases. We know it's a hard time for people. Not being able to grieve in the way we normally do is very challenging. But these restrictions are in place because we know how this virus is transmitted. Gathering large people indoors for prolonged periods of time puts us at risk of transmission, and we see that risk now. We see many cases linked to this type of gathering. And so we've obviously been trying to discourage large gatherings indoors at events such as funerals, even though we know how difficult that can be. We've had people attend medical procedures without disclosing that they have been in contact with a close case. This has left dozens of healthcare providers off work, needing to self-isolate. We have an entire surgical team at home for 2 weeks because of this non-disclosure. So this puts significant strain on our healthcare system. We have an individual who was very likely acquired their COVID at a faith-based organization, a large gathering, and later was a visitor at a personal care home, which led to the beginnings of an outbreak at that center. So we see as we increase the number of people we're in contact with, we increase our risk, and that risk can be transferred to people in very vulnerable settings. We've had people go to work and social gatherings while they're experiencing symptoms. And this is one of the things we've been saying from the beginning, that we have to change if we're wanting to be successful. We've had an individual attend work for an entire week while symptomatic before being tested. We've had individuals who had had symptoms for a week, got tested but did not self-isolate. They went to a large social gathering. They had a gathering at their own house. Many contacts, including cases. We've had many people who went home or stayed home because they were ill, only to feel a little bit better the next day and then go back to school or work, only for those symptoms to return, and then later exposing many people to the virus. We've had a specific example is an individual who left work because they were ill, but then went shopping and exposed many people at many different events. A known positive case had a gathering at their home, exposing many people. So we need to decrease our contacts outside of their household. We need to change how we're doing things right now. Everyone can think about this as if public health contacted you, would you be able to tell them who all your contacts were in the last week or even over the weekend? If that would be difficult for you, it probably means you've had way too many contacts over that period of time. And that's the challenge that public health is. We can't get to everyone's contacts because people can't remember all the people they've been in contact with. It's because we've largely went back to our normal ways of gathering with large amount of people. And these numbers show what happens when we do that. So we should be clear that these numbers are trending in the wrong direction. If we look at where we were during our first wave, we can see that, we let the virus off the hook. We know exactly how this virus is spread. We're in a pandemic. We have to expect to see cases. We can't avoid that. We're going to see cases. But what we shouldn't expect and we shouldn't accept are people who have 50 contacts, or people going to work when they're ill, or people not being forthcoming with healthcare providers. This is what leads to numbers that we're looking at right now. And there's, a lot of people have made tremendous effort, so thank you. But we definitely need to, as a population, change how we're acting right now, because we're definitely seeing the trend in the wrong direction. We all have to do as much as possible as we can. We need to reduce the number of contacts we have outside our household. We need to avoid socializing with people outside our household. Avoid closed-in, crowded spaces. And those who are at higher risk, those over age 60, those with underlying medical conditions, you need to consider staying home more often, reducing that risk of being exposed to this virus. So although these numbers are quite concerning, it's all giving us a moment of pause. We all know what we can do. And we can all do that today. We can all reduce our risk of acquiring this virus today by practicing those fundamentals that we speak about. Halloween is coming up. And so Halloween's going to look different this year. If you're feeling well and you're sure you can be out without any close contact with others, you can find a way to try to enjoy Halloween. People who are giving out candy need to be mindful of ensuring they're well, mindful of keeping distance from others, using non-touch ways of dispensing candy. People who are considering having a Halloween party. I hope these numbers and some of these explanations have dissuaded you from doing that. One, it's against the law right now with our group sizes, and two, you can see that we put people at risk with large gatherings. So we all know those fundamentals. They sound easy to follow. We know they're challenging, and we know they're not being followed by many. We have those many examples of people showing up and out and about while ill. And we just can't be successful if that happens. So we're calling on all Manitobans, please stay home if you're ill. Get tested as soon as you can. And don't return to work or school until you're negative COVID, or you've self-isolated for 10 days if you didn't get tested. We know that influenza season is on its way. We've acquired 20% more doses of vaccine. We've increased our eligibility criteria for HD, the high dose vaccine. We've shipped out 31% more vaccine to date compared to last year at this time. And we've shipped out over 400,000 doses of vaccine already in Manitoba. So that vaccine is out there. So I encourage all eligible Manitobans, those 6 months and older, to get that vaccine and to get it soon. And so thanks again to everyone, and we'll continue to work hard to keep these numbers manageable. So thank you, and I'll pass it over to Lanette.
Thank you, Dr. Roussin. So I'm Lanette Siragusa from Shared Health, Chief Nursing Officer, and I'm back with you today and for the foreseeable future as the effects of this pandemic continue to escalate and impact our healthcare system. Over the past few months, internal planning and preparations have been ongoing at an intense pace in anticipation of the next wave, which we are, I would say, now in. And I want to take this opportunity to first thank all the clinical leaders from throughout the province whose expertise and dedication has been unwavering over the past many months. We are so grateful for your contributions. And while these public health experts and first responders and clinical specialists are doing everything within their power to be ready to respond to the public need, their level of response is dependent on all of us to do our part, to make good choices, and to minimize the spread of COVID-19. In managing this pandemic, our system has focused on three basic things: test, trace, and isolate. On the COVID testing front, we have seen a number of improvements in recent weeks, with the opening of new sites and additional staff being trained. Scheduled appointments are now being accepted at 3 Winnipeg sites, that's Portage Avenue, Pembina Highway, and St. Mary's Road, as well as in the evening and on weekends at Dakota Medical Center. So this lessens the need for lineups and is more convenient for people who need to go get tested. The walk-up or drive-up sites on Main Street and at Thunderbird House and on Nairn are still also available. The partnership with Red River College to train swabbers has resulted in significant interest, with 90 students enrolling in a matter of days. Work is now underway with the health regions to identify the areas of the highest need, and those providers who complete the training will be deployed as soon as possible. In the past week, the turnaround time for lab samples to be processed in the lab has ranged from 29 to 41 hours. And that doesn't include the transport time, that's just that lab turnaround time. In terms of contact tracing, health regions are pulling together to support overall contact tracing needs of public health throughout the province. So they have already redeployed staff to prioritize case investigations, contact tracing, and notification, as well as perform the daily follow-up of cases and contacts during their self-isolation. Additionally, a small team from the Canadian Red Cross has begun work just on Friday, actually, to help with daily contact monitoring, which frees up public health to do the contact tracing. And there are plans to potentially scale this up in the coming weeks. As well, Statistics Canada is looking at helping out as well with contact tracing and providing staff to support that. Our isolation sites have also seen significant increase over the past several weeks. Right now we have 41 people who are currently in the hotel program, and since they have opened on October 4th, we've seen 268 individuals who have used this space. They receive daily checks, wellness checks. They have online consultations with primary care or specialists, and occasionally, if their condition worsens, there are paramedics who will come on site and transfer them to hospital if need be. The isolation team also provides support to individuals who are isolating at home to give them guidance on best practices to keep themselves and their families safe. As you know, there's also a shelter program for those who are experiencing homelessness. There are currently 27 people isolating at that site right now, and their occupancy is 95%. And the total number of people who have used this site since opening in April is 404 people. The Red Cross as well is involved in supporting isolation efforts throughout Manitoba. Additional staff have been hired or deployed and trained to work in the isolation centers to make sure that there is ongoing capacity as we see these numbers rising. In the past week, the number of Manitobans in hospital with COVID-19 has increased dramatically to 80 people today. And by way of comparison, there were 28 people in the hospital last Monday. And over the past week, we have seen many older, elderly people in our hospitals, but we have also seen children and teenagers. The total positive active case numbers are obviously much higher now than they were in the spring, than they were last week, and we are monitoring this situation very carefully as it pertains to hospital admissions. I do want you to know that we continue to have capacity across the system, both in medicine and in intensive care. And that is because we are coordinating these services across the province so that we can serve the COVID cases closer to home when that's a safe option. However, if we continue to see increases like this, we will likely need to implement some of the measures that we took in the spring in terms of staffing, redeploying staffing, so that we have enough capacity with beds and equipment for COVID patients and other patients as well. Postponing elective and non-urgent procedures or decreasing any type of healthcare service is our last resort. However, this is a way to free up the resources that may be required for COVID or influenza. So if that becomes necessary, that is an option that we would have to look at. From our planning in the spring, we are confident that we have adequate space and we have procured the necessary equipment and supplies if there is a surge. Our PPE inventory is in good shape. Markets have opened up, orders are being filled, and supplies are being delivered. Our stockpile of PPE is continuously being replenished and fortified. And we consistently evaluate the evidence and leading science. We follow the guidance of our infection prevention and control experts and staff health. And we scan leading practices across the country to ensure that our staff stay safe and protected, as well as the public that we serve. And that is and will always be our top priority. So on Wednesday, when I come back, I'm going to provide much more detailed information about the staffing situation in the province and what our strategies are to build capacity and support our workers. It's a very important topic, and I want to ensure that I give it the dedicated time that it deserves. But for now, I will send a message to the healthcare workers that help is on the way. And for the public, I want to assure you that our system remains capable of caring for people who get sick with COVID or any other illness. Our facilities are safe for you to come when you need healthcare services, and we encourage anyone who needs it to seek it. We are here for you. And as Dr. Roussin spoke to, we ask that all Manitobans be honest about symptoms and exposure history when presenting for care. You will not be denied care. If you need care, you will get care, but sharing the information about your symptoms or if you have been a close contact with a confirmed case of COVID-19 will allow us to provide you with the appropriate care while ensuring the protection of our healthcare team who is taking care of you. And it is true over the last few days, we've seen instances of patients not being forthcoming about their COVID history. And in one instance, a patient who was not honest and later tested positive was responsible for sending an entire team home for 14 days. So we are committed to protecting the staff, and we know that Manitobans are committed as well. We are here for you. We will take care of you, but we ask that you please answer the screening questions truthfully and completely when seeking care. So we are coming up on what is likely going to be a defining moment of our lifetimes. And as individuals, as families, as Manitobans, there's going to be significant challenges in front of us as we head into the next several months. But we are not powerless, and we are not alone, and this is not going to last forever. So Manitobans once again need to come together and rise to the challenge that COVID-19 presents and work together to flatten the curve. You may not be at significant risk, but your loved ones may be, and I implore you to think about them. This virus is demonstrating the vicious impact it can have on our most vulnerable. It brings fear to our very courageous healthcare workers who show up each and every day to be there in case you need them. So they're doing their part, and the rest of us, we need to do our part. We need to practice that physical distancing, avoid large crowds, get your flu shot, stay home when you're sick, and wear a mask when you're out in public. And by working together, we can and we will get through this pandemic. So with that, I will open up the floor to questions.
Thank you. Up first this afternoon from City News, Jonas. Good afternoon, folks. Lanette, maybe I'll start with you this afternoon, if that's okay. We heard from the individual, or from management at Parkview Place, their medical officer this morning, from a representative from the WRHA. Another death today, I believe that's 18 total, if we could also confirm that. Can I just get your, as the Chief Nursing Officer, an idea of what's going on there?
Yeah, well, we've always known that the people who live in the personal care homes are a high-risk population. We put pretty severe restrictions in place in the spring in terms of visitor guidelines. We loosened those up because there's a risk-reward there. And so it is not the first, Parkview's not the first PCH, and it'd be nice if it was the last, but it is a high-risk population, and we have to be careful in who's visiting, how many are visiting, and the practices when we do visit. So I can tell you that I know the company has been working hard, has been working with the region. They do have challenges. They have opportunities for improvement, and I'm quite confident that they will actively pursue those. And right now, the most important thing we can do is make sure that those residents and the staff are safe and protected.
As a follow-up, Lanette, on that, we heard from the facility this morning, staffing shortages are huge. You touched that we'll hear more Wednesday about the direct system. Can you just maybe give us an overview of just what is the system dealing with in shortages right now?
Overall, well, I can tell you the vacancy is actually, and I'll give much more details on Wednesday, but the vacancy of staff is looking much better than it did a year ago. We are very lucky that our educational institutions progressed with graduating their students, so those students are out and getting ready to work. We have made active attempts for recruitment and retention, and I'm optimistic about that. Our problem right now is absenteeism because of sickness or because of parents who have children who are sick. And so that is an impact. It's an impact that we anticipated, but it's still one that we have to manage, and it's challenging.
And just one for Dr. Roussin here, as I can follow up, sir. One comment struck me that you spoke. You said by the end of the week we could have 5,000 cases. Can you just address what the data is showing you as far as exponential spread and how you arrived at this?
Well, we're just following the current trend of cases. We can see we do have some information on our R value, the reproductive number, and that's nearing 2 for us when we looked at that last week. So, the trajectory is in the wrong direction, and if we continue at this rate, then we're likely going to see over 5,000 cases by the end of this week.
From the Free Press, Danielle.
Hi, and good afternoon. Dr. Roussin, my question is for you first. You've previously described our health system capacity as being in the green. Where would you put it on that scale today? And can you describe the demand and capacity available in the hospitals related to COVID-19?
Yeah, so I don't know, Lanette, do you want to take? Yeah.
I can speak to that. So we're definitely busier now than we were in the spring. I would say our emergency visits are down compared to last year, but not the same as what they were in the springtime. Our medicine beds are about 90% occupied, which for us is fairly normal. And there's also capacity right now in critical care. So I would say there is space and an ability to accept more patients into acute care. It is getting definitely much busier than it was a week ago. So I don't know in terms of color coding, maybe green into orange, but we're not in red yet at this point.
Thank you very much for that. And I was hoping to get some clarity on which hospitals have COVID-19 wards. Can you tell me which hospitals are providing treatment for patients, and how many units and beds are available in each?
Well, that's a pretty detailed question. I can say that there are COVID patients throughout Manitoba. Are you specifically asking of COVID patients or outbreaks?
Okay, so I'm wondering about COVID-19 specific wards, so not necessarily outbreaks, but the hospitals that provide care for patients with COVID-19 when they do need hospitalization. So my understanding was it was HSC and St. Boniface, but if you could clarify that for me, that would be great.
Yeah, I think there was actually maybe more. I can get back to you on the details. It's really an operational, depending on how many COVID patients are in a specific hospital, they will designate a unit to COVID. But it may be that if there's only one or two, they are isolated, but in a mix with other people. But the appropriate PPE and precautions would always be taken. But we can get back to you on that question.
From Global, Brittany.
Good afternoon, Brittany from Global. Lanette, I guess this question is likely more for you here, but we've spoken to a doctor at St. Boniface who's been very outspoken, posted a Facebook message this weekend basically saying, you know, the hospitals are on the brink right now. Staff are exhausted, they are overwhelmed, they are over capacity. Maybe just give us a bit of an update on the situation at St. Boniface and what you say to those healthcare workers right now who are in there saying, you know, we can't take much more of this.
Mm-hmm. Certainly the sites where there is an outbreak, whether it's a hospital, a personal care home, those are very stressful places to work. There's stress. There is often individuals and teams going home on isolation, and it does feel like it's on the brink, and it's an understandable anxiety that is causing for healthcare workers. We are working as a system to redeploy people to support the staff and support the patients. So I can tell you some of them have been hospital acquired, some have come in with COVID, and some has been, well, I guess that's the two options. It's hospital acquired, or they came in and were maybe not symptomatic when they came in. So we have infectious diseases involved in every single one of those cases, as well as advising on what the staff protocol should be and doing the contact tracing. So they are looking at each individual case, looking for trends, looking for if there were any PPE issues, breaches potentially, which can happen unintentionally. So maybe we need more education on that. And really it's about the test and the tracing and the isolating. That we always come back to that. So it's really the timing on when people are symptomatic, when they're tested, and how soon we know and we can put the plan into action.
From the Brandon Sun, Colin.
Hi there, Dr. Roussin. I'm sorry if I missed this earlier, but is there any update on the situation at the Swan Valley Health Center?
No, I don't believe there is anything new to report at that center. It remains at red, and I don't have any new numbers on that.
Following up on that, I've noticed recently that Prairie Mountain Health is consistently the lowest, or the one of the lowest health regions in terms of daily cases. Why do you think that is right now?
Yeah, and right now, I mean, I think it's what we're going to see. We're going to see certain regions, whether it be a region Manitoba or neighbors, with trending up, while some are trending down. We're going to see this variability, and there may not be a specific explanation from it. I do know that from reports of public health, even in Prairie Mountain Health, the cases we're seeing, the contact investigations are becoming much more complex. Many more contacts involved in case investigations, and so although we're not seeing large numbers right there at this point, we are seeing the same type of trends in people having many more contacts than they used to, and so we could be in a position where that region may not be far behind.
And with cases in Winnipeg continuing to be high, do you think that the level orange restrictions aren't working as well in Winnipeg as they did in Prairie Mountain Health?
Well, there's a couple of things. It's hard to judge because the outbreak in Prairie Mountain Health, as you could see at that time, we were able to specifically, locate it geographically, and as well as the various clusters. So we could really tailor those the outbreak measures, the outbreak response to the actual epidemiology. What we're seeing in Winnipeg now is the more wide-based, community-based transmission. So it's very hard to target. And then we can see in many of our neighbors, east and west, and throughout the world, we're well into a second wave now. And so we're seeing increased numbers, in most jurisdictions now. So we're going to continue to watch. We know that the numbers are trending in the wrong direction. And these latest restrictions we put in Winnipeg Metro may not have had the time to take full effect as yet. We know that Thanksgiving had likely a negative effect on our numbers, so we'll continue to watch things moving forward.
From CJOB, Marnie.
Good afternoon. Dr. Roussin, if we see our numbers keep going in this direction and don't see any turnaround, what's the next step in terms of putting in more restrictions, and at what point do we need to go back to the similar restrictions or the lockdown that we had last spring?
Yeah, and I think we've all jurisdictions have learned a lot about the virus. We've learned that we do have the ability to be a bit more targeted in our approach for this, and we know the big transmission areas, right? This is prolonged, largely indoor contact. And so this is where our restrictions are mostly focused. And moving forward, we're going to have to just be more stringent on those restrictions. If we don't see the numbers coming down, then we'll have to further reduce the ability of people to gather, in larger numbers, because that's where these numbers are showing where we get these large number of contacts from. So anything moving forward further would be looking to reduce indoor gatherings.
Thank you for that. And on the gathering sizes, we're obviously not seeing the compliance that you would like to be seeing. And we're hearing of situations like you mentioned, a bunch of the examples of people attending social gatherings. What kind of, for those examples you listed, what kind of follow-up or enforcement is being done about some of these instances?
So overall, we have the ability to enforce things, and I think that as we continue to see these numbers climb, if we see that we're not getting the adherence we need, then we'll have to step up that enforcement. If we see cases or contacts that are putting others at significant risk knowingly, then we have that ability to enforce as well. So I don't have any specific comments about any specific cases, but we're really aware that we may have to step up our enforcement to ensure we can address these increasing numbers.
And can you also confirm the test positivity rate for the Winnipeg metro area, please?
8.3%.
From the Winnipeg Sun, Scott.
Good afternoon to you both. Scott Billick, Winnipeg Sun. First question for Dr. Roussin. Why have Halloween? Why even allow it at this point? And why not institute reduced gathering sizes already? Like the numbers are bad enough as they are, and you're expecting, or we're expecting them to be worse by the end of the week. Why not just take those precautions now, given the state of the province?
Well, we do have significant reductions in group sizes right now, so we have to make sure we're all focused on that. We can't be finding ways around it or trying to function and try to get ways that more people can gather. We just have to, we have to accept that we're in a pandemic, and this virus spreads from gatherings indoor places, and if we have multiple people we're gathering with over multiple days, then we have large amount of contacts. So we're going to continue to look and see if we have to restrict that even further. As far as Halloween goes, we have some guidance out there. We have the restricted group sizes, so if people follow that, then again, we're looking at a low-risk situation. We shouldn't be having Halloween parties outside of our household. We be creative and find ways for the kids to still enjoy things. It's a real challenging time for them as well, so we have to find ways to keep the kids having enjoyment. But we can't have large gatherings, can't have the adult Halloween parties. If we do go trick-or-treating, there's ways of making that safe, but nothing we do is without risk. And like I said, there's consequences either way. We've heard of some jurisdictions that may have just canceled or whatever, however you want to describe it, Halloween, and we're under significant criticism as well because there's certain benefit to have people enjoy things. So these aren't easy decisions, but we think our guidance that's out there, we think raising the alarm here today is going to help people make wise choices for what they do want to do for Halloween.
Thank you for that. And my first follow-up is, why not retroactively fine people? Like, I mean, it's good to obviously talk the way that you did today to try and get that in, but I mean, and I know you've said in the past not to, you don't want to discourage people from telling about where they've been and that sort of thing, that they've been in contact with people. But we're already seeing that it doesn't matter whether if there's fines or no fines, people aren't doing that. So why not retroactively fine those people and make it look at least that there is some enforcement being done?
And we are looking at just that. So if there's individuals that we found that were violating the orders, I mean, most fines we do would be after the fact, right? Because that's how we would find out about it. Certainly wouldn't do it retroactively if you mean prior to when the orders were in force. We certainly wouldn't do that. But we are investigating all these, and we are looking to step up enforcement. And we know the issues with stigma, right? Stigma is important, right? We not only because of the ethical reasons, but it also drives people away from being testing, and it drives people out of the system. So we want to be careful with that. But if we see people who are blatantly putting others at risk and not following public health advice or orders, we will enforce this.
Thanks for that. And my last one is, do you know through contact tracing, any indication through contact tracing about how much transfer is taking place due to people going to work sick instead of staying home, as to people transferring it, at types of gatherings and stuff like that? Do you know how many cases recently, I suppose, or through contact tracing that has taken place from in the workplace from symptomatic people?
Yeah, I don't have the specific numbers on that, but just to put it in perspective, is those examples that I listed today, that was from this past weekend. So these are occurring commonly. So we really need to double down and focus our efforts.
From CBC Radio Canada, Mohammed.
Hello, Dr. Roussin and Lanette Siragusa. I have a question for Lanette Siragusa. You've talked about some PPE issues breaches maybe at St. Boniface Hospital. I would like to know if you believe that these PPE breaches are at the beginning of the outbreaks in St. Boniface Hospital.
Well, PPE breaches are always a possibility. PPE is great. We believe it works and it's effective, but it's always a risk. So we talk a lot about the donning and the doffing of the PPE. There are videos, there's education throughout the pandemic, both in the beginning, but also again in the fall. We took efforts to go out there again and make sure that people had the education available to them to use good precautions. So the situation at St. B, I can't speak to the details if there was a PPE breach. I'm just saying that it's always a possibility. So if the PPE works and there's an outbreak, we have to look at what's been happening. It could also be that people were asymptomatic when they came in. So there's different reasons, or they are symptomatic when they came in, but maybe the testing wasn't back. So there's lots of different reasons why this is spreading. But one thing for the staff is that we are following that evidence. We are talking to the experts. When PPE is used, it's effective, but there's times when you're on your break, when you take it off, where, there's those things that happen all the time that you just have to be really careful and you have to use good practice. So in terms of the St. B, I can't speak to the details on that, but it's just that's a common universal thing.
Great, thank you for your answer. And I was wondering, some unions are talking about testing all staff that are in COVID units, like housekeepers too, not only medical staff. Is it a thing that you could put in place in the future?
Yeah, and I'd like to talk about that on Wednesday, Mohammed, but that is something that we're looking at, and I think that there's good potential there.
Great, thank you, and I have no more follow-up.
From CBC Manitoba, Bart.
Ms. Siragusa, welcome back, and my condolences. What is the impact at St. Boniface Hospital having the entire surgical team out on isolation?
Well, it wasn't the entire surgical team. It was one surgical team out of several surgical teams. So the impact is that they will try and backfill that team. So at this point, I do not believe there was a couple actually of positive cases in the surgery team over the weekend. And so they are trying to keep up with the demand. If they slow down, it's not because that it's a bed issue. It's about backfilling the staff. And at this point, I don't think that they have stopped surgery at St. B. I think they might have decreased a little bit, but they're trying to keep up with current workload.
Thank you for that. Why did the province fail to adequately scale up contact tracing during the Prairie Mountain Health outbreak, let alone the Winnipeg outbreak?
Well, we have scaled up contact tracing, and certainly we had that time in the Winnipeg region where we had many days in a row, and currently on that with many cases. So there was a backlog over this weekend. It was significantly addressed. We've had a number of regions that we stepped in to scale up that. We now have the Red Cross, who for a long time we've been planning on increasing our capacity, will be on board. And so we have scaled up things, and it's we're closer and closer to getting rid of any backlog.
All right, thank you for that. What percentage of contacts right now are being identified within 24 hours as per the recommendations?
Yeah, that one there, it's hard right now, Bart, to report on that because we're during the way we're reporting it through the backlog. So we're going to have that updated probably within the week or so, but I don't have that number right now.
All right, thank you for that.
From the Canadian Press, Kelly.
Hello. So we're obviously seeing significant increases when it comes to hospitalizations as well as stays in the ICU. Previously, you have noted that those are numbers to watch. So at what point is the pressure critical on the healthcare system?
Well, I would say it gets critical when we have to start redeploying staff and decreasing services so that we can free up the staff to redeploy and dedicate to COVID. So we're not there yet. We are preparing for it though with these high numbers. As soon as we see the high numbers of cases, then we know that it's a matter of time before they're coming to the hospital. So we are getting ready for that. So to me, that's the critical point, is when we have to say we have to decrease surgery or we have to cut something in order to support something else. So we're not there yet. I anticipate if these numbers keep rising, we will be there soon.
You know, what kind of numbers are you looking at when you say soon? Can you give us a bit more detail of what those would be?
Yeah, I think in the spring, we did a lot of planning, capacity planning. So I do feel confident that we've identified physical footprint where we can expand beds. I know that we have the ventilators, the EKG machines, the IV pumps, the beds. So those are all in place. As I said, the PPE supply is good. It's really dependent on the staffing. So we need to keep our staff healthy. We need to keep our staff safe. And we need to support them. Part of it also is recruiting new staff and also having models of care. This is really important. I talked a lot about this in the spring, but how do we all work to our full scope of practice in a team-based environment so we can take care of the patient's needs? So the teams are looking at that right now. A lot of detail was done in the spring, but we're dusting it off and getting ready to implement some of those changes as we need to. So it's really, you know, I'm sorry, I can't give you a direct answer because it really depends on who's coming to our hospital, how many are coming to our hospital, and what kind of condition are they in when they come to the hospital, how much intensity, what kind of skill set is needed to support them. So as I've always said, we are planning for the worst and hoping for the best.
And I've heard from some nurses who have said that they were told to continue working despite having some symptoms, and that they later tested positive for COVID-19 and are part of the outbreak. Can you speak to any concerns that you're hearing from nurses who might, because of staffing levels, be encouraged to come to work even though it might not be safe?
I don't know the details. I would think if they're symptomatic, they would be encouraged to stay home, but I don't know the details of that. I'd have to look into it.
From CTV Winnipeg, Michael.
Hi, good afternoon. My first question is for Dr. Roussin. I'm just wondering, when you're talking about known positive cases having gatherings and people not being forthcoming about their symptoms, are you feeling any feelings of frustration or disappointment just knowing that so many of these cases were community transmission?
Well, I mean, I think we're all here to improve the health, to protect the health of Manitobans. And so when we see actions like that, then that's putting Manitobans at risk. So, I think we all should be, disappointed and concerned that's occurring because, like I've said, no one's risk is entirely their own. And so people, can do their own risk assessment, but, when you put yourself at risk or even when it's clear that you're putting others at risk, you're really putting all the Manitobans at risk. We're seeing these cases that have sometimes over 50 contacts. And we know that there's a significant proportion of those that will become cases, and they themselves will have contacts. So we just, we really need to change what we've been doing lately, but we know how to do that. We've done it before, so I'm sure we can and we will do it again. But it just, it may have took something like this to really, raise that alarm for Manitobans.
Okay, thank you for that. And my second question is about Headingley Correctional Center. They're dealing with COVID-19 outbreaks right now, positive cases among staff and inmates. I'm wondering, is there an initiative to test guards as well as inmates? And if not, why not?
So, certainly symptomatic people will be tested. People who are known contacts will often be tested. So I don't know all of the details are on there. Justice is working with one of our medical officers of health very closely right from the beginning, and so they've been working on that plan.
And I also had a question for Lanette Siragusa about the testing, the turnaround time. You said it was between 29 and 41 hours, but you also said that's not including transport time. So I'm wondering how far these tests get transported and how much time does that take?
That's a really good question. So within Winnipeg, the transport time's pretty minimal, but it can be longer for if you're farther away from a lab. I would say also in Prairie Mountain, they have a quick access to a lab in Brandon. But there is some travel time that's required, so it can take hours to. We're actually doing an assessment, so let me look into it before I misquote myself. But it can add on some time to that lab turnaround, the transport part, and it is different depending on the geography.
From CHVN, Taylor.
Hi, good afternoon. Dr. Roussin, earlier you mentioned about an exposure or something along those lines at a faith-based gathering. Can you tell me more about this, or if you're seeing more potential exposures at faith-based gatherings?
I've seen what we think are acquisition events at various faith-based gatherings, and it's not the fact that they're faith-based gatherings. It's the fact that this virus is spread through prolonged contact in indoor places. And so you can list whatever venue that meets those criteria, and you can bet that there's virus being transmitted there. So we have to really step up when we have positivity rates of what we're seeing right now. And if you're in a group of hundreds of people, there's a very good chance that someone in that group is infectious.
And will the province be opening up all of the personal care home visitation shelters at the end of this week?
I don't have an update on that.
And seeing that we have a lot of cases of COVID-19 now, the number of deaths is increasing, what messages do you have for people who are losing hope?
As hope goes, I think that we know exactly what we can do. So if we look at ourselves and the loved ones around us, we can reduce our risk right now today. Right? We can stay home certainly when we're ill. We can limit our contact with people outside of our household. Wash our hands. Wear a mask when we're outside. So we have actions right now that we can take. We've never been helpless. And that's why when I say we've let the virus off the hook, it's the virus isn't being transmitted in some manner that we weren't aware of or something that we didn't prepare for. We're not helpless. We have the ability right now to reduce the transmission of this virus. So that is something that people can take into their own hands right now today.
From the Carillon, Jordan.
Good afternoon. A question for Dr. Roussin concerning Steinbach. After being in the single digits throughout much of the pandemic, the Steinbach Health District's number of active cases more than doubled over the weekend from 22 to 48, and today stands at 44. Do you know what caused that sharp increase?
Well, I know that there is community-based transmission that's occurring, and while I don't have the specifics, we know it's gatherings. So we need to decrease the amount we gather outside of our household. And so we're seeing similar trends like that. We saw it in the north where we actually added further restrictions. We're seeing it in the southern health region increase test positivity and cases. So it's just this, we're well into our second wave, and prolonged indoor contact with a large number of people or increasing our contacts outside of the household is what's spreading this virus.
Thanks. And with the rate of cases per 100,000 for the Steinbach Health District now similar to the hardest hit neighborhoods in Winnipeg, are you considering extending the Code Orange restrictions into the greater Steinbach area?
Yeah, we're always looking at our pandemic response system. So like we've said, nothing is off the table. And when we're seeing climbing numbers like this in multiple regions, we're paying close attention to that.
Thanks. And just lastly, any more cases to report at the Exceldor plant in Blumenort or Arborgate School in La Broquerie?
No, I don't believe there's any more cases to report at the that food facility, and no updates on Arborgate either.
From CKDM, Matt.
Hello, good afternoon to both of you, and I'll leave this question open to whoever feels inclined to take this one on. Just to be clear, are there any further details you can provide at this time about the outbreaks at both the Swan Valley Health Center and the Swan Valley Lodge Personal Care Home in Swan River that were declared yesterday?
Right. No, I don't have any further outbreaks on that. We continue to investigate, but I don't have any new information.
Okay. As a follow-up, I have a question about the terminology of outbreak. I know a single case can constitute an outbreak, correct? And what is the public health utility of declaring an outbreak and moving a specific site to red on the pandemic response system?
Yeah. So typically, outbreak, the definition of outbreak is just more than what's expected. And so that can vary with the pathogen, it can vary with the setting. And so for something like COVID in a high-risk setting like a personal care home, you're right, to just a single case, we would declare an outbreak. What the benefit of that is, it will implements immediately the outbreak measures, which is widespread isolation, ending group gatherings, enhanced, infection prevention and control measures. So it's just enhanced measures that we do. So it depends on the setting. It sometimes can depend on the pathogen as well. But with COVID in personal care homes, long-term care facilities, a single case is going to result in an outbreak for us.
Thank you. And my final question would be for Lanette. As far as the province now introducing more appointment-based testing, is there a plan to perhaps make an eventual shift to make all testing in Manitoba an appointment-based system?
I think we are looking at spreading it. We just wanted to do it in a gradual way and make sure that we worked out the kinks and built on success. So I think that will be coming soon.
From the Thompson Citizen, Ian.
Hi, Dr. Roussin. This is Ian Graham from the Thompson Citizen. Do you know what the current test positivity rate is in the Northern Health region?
I'll have to check what my update is. 4.8%.
Okay, thank you. And do you know, like in the north, what percentage of new cases or numbers are like community-based transmission, not linked to known cases?
Yeah, well, right now, with the way we've been contact tracing, we don't have good numbers right now. We haven't been reporting the non-EpiLink cases. What we do know is that province-wide, a growing number of our new cases are non-EpiLinked, which is guiding us to think that we're just getting back to too many gatherings.
And so, just lastly, in in the north is the high number of contacts versus the number of contacts you're seeing among people, cases in the north, similar to what you're seeing in other regions?
Well, we have definitely seen increasing numbers of contacts there. I think right now in the Winnipeg region is where it's most highlighted. But we're seeing that trend as we had that nice time during the summer. We've now seen that cases are reporting increased number of contacts in general.
Thank you, and this concludes today's media briefing.